These days, more and more Canadians are living with complex chronic disease and disability. These individuals face some of the greatest challenges in managing their health and are often at risk of experiencing poor health outcomes. Through over a decade of research, Dr. Ross Upshur has seen the effects that complex chronic disease and disability can have on a patient's daily life. He is amongst the leading authorities on the needs of those living with complex chronic disease and disability.
A complex patient is best understood as a person who suffers multiple significant challenges to optimize their health. These challenges often arise from the intersection of multiple concurrent chronic diseases, mental health, substance abuse or cognition challenges, and challenges with respect to social determinants of health such as optimal housing, poverty, and food security. What these patients need are tailor-made solutions that articulate their needs and goals and are perfectly related and calibrated to them. And mobile technologies are a way of actually achieving these goals.
Technology may offer the solution healthcare providers and researchers like Dr. Upshur have been seeking. The Electronic Patient Reported Outcomes, or ePRO tool, is designed to support delivery of personalized, goal-oriented primary care by allowing patients to work with their providers to set and monitor health-related goals. Primary care providers can include physicians, nurses, dietitians, social workers, or any provider delivering primary care to patients. Here's how it works. The provider and patient start by entering a purpose statement. This serves as the overarching goal. Once a purpose statement is entered, goals are added and refined according to whether they are specific, measurable, attainable, realistic, and appropriately timed, turning it into a SMART goal. In the Editor tab, the provider and patient can work together to create questions that will help track a goal. What kinds of questions and how often feedback is needed can be adjusted as well. Each goal is linked to a goal attainment scale to create a standard way of seeing how patients are doing across different types of goals. Patients are able to provide comments on how they're doing in relation to their goals. The tool also includes a variety of validated outcome measures that can be used to monitor patient progress, like the PROMIS Health Assessment Questionnaire and others. Once the goal is created, the patient can track their progress outside the exam room. Monitoring alerts will automatically appear on the patient's ePRO tool, and questions can be answered quickly and easily right on the patient's mobile device or directly on the web-based portal. Once a question has been answered, the data is then viewable by the provider. Providers can monitor progress and tailor care plans as needed, and patients can self-monitor and share info with their caregivers to help them manage their conditions at home. If the patient is not yet ready to goal set, patients and providers can simply track outcome measures to get a sense of how a patient is doing over time. The clinical lead for the ePRO project is Dr. Laura Cruz.
Tools like ePRO can help patients set goals to improve their health. Having access to dashboard metrics, providers like myself can see at a glance whether a patient is moving in the right direction with respect to their health goal. It can also help us understand whether health outcomes like mood or mobility are being impacted. So ultimately, we get more done in a visit.
ePRO has helped me to strengthen my partnership with my health team. We created my goals together, which gave me a great sense of control over my health care. ePRO reminded me of what I needed to do and helped me to track how I was doing on a particular goal. It also helped to know that my doctor was watching my progress with me through ePRO.
The ePRO tool is an innovative approach to tackle some of the biggest challenges facing patients with complex chronic disease and disability, their healthcare providers, and their caregivers.